As we watched very carefully the national health care reform legislation roll out, a few things are of note. A couple things happened that were good for kids. One, there's no lifetime limits on insurance now. Again, kids can hit lifetime max in the past within 6 months. You have a very sick neonate, they're going to hit that lifetime max early. There's also no pre-existing conditions, and again, many of our kids have chronic illnesses, and so they can't be denied care because of those pre-existing medical conditions. The other important thing that happened, and we lobbied really hard for this, is that pediatric specialists are also considered now primary care doctors. When you have complex kids that need heart issues, things like that, many times that specialist does provide that primary care, so it's one-stop shopping for families, makes it very easy, and their expertise in that, they can be the quarterback of that care. And so those things are very positive. But I have to tell you, kids were not talked about in the national health care reform debate because it was really all about Medicare. Most of what we do is on the level of Medicaid, which is a state-run program. So as they were talking about things like accountable care, et cetera, there wasn't a strong voice being heard on the part of kids. Now, I've been to Washington several times, and we know that there is a drive towards accountable care organizations. Again, that's back to that population management I talked about in the past. So rather than just being the fixer-upper shop where you take care of people when they're sick, you use your primary care, you use your insurance companies and things like that so that you can manage care, not manage the cost of care, but manage care across that continuum. I've met with Secretary Sebelius. I've asked her to consider us to be a pediatric pilot. I can tell you we are the organization in the United States for pediatrics that is perfectly set up to be that. And again, that's where we can create the incentives to lower the cost of health care by keeping kids out of the hospital, out of the emergency departments, and really managing their care better on the front end. Well, Children's Community Health Plan is our Medicaid HMO. We went into that about 5 years ago because we really believed that if we could have a not-for-profit, provider-based way to insure our kids and take risk from the state of Wisconsin, and it's only for Medicaid, that we could better determine where the very best care is needed, where it can be accessed. And so we were successful in the most recent bid, the RFP process, that the state of Wisconsin went through with the former administration. We cover 44,000 people in our Medicaid HMO. Most of those are kids, but it's also pregnant women and some older adults. Corey, that's a great question because it is, I think, fundamental to our success as an organization in the future. It's one of the reasons I wanted to come to Children's Hospital because I believe if you really do get serious about managing the population of people, that then you can send dollars where you know there are gaps in care. And I'm going to give you a really good example of that. We realize that there's a medication that can be given to women at risk for a premature baby. If you've already had a premature baby, you have a much greater risk of having that happen a second time. This medication's very reasonable to give. You give it while the woman's pregnant, and it does prevent early preterm labor. And in fact, in 20 patients, we had 18 that actually delivered a normal, healthy baby, and these are the women that were most at risk. I think the total cost of therapy was about $700. The state of Wisconsin would not allow payment for that, so our health plan said, forget it, we know we need it, we know it's important, we're just going to go ahead and absorb that cost. Well, if you looked at the cost of a premature baby, it could be as much as $500,000 versus $800 for this injectable. Now, you may have seen in the paper yesterday, the very company that manufactures this drug has now taken it from a very inexpensive product to charging $1,500 for that same course of treatment, which would have cost much less than that. So you look at the cost of health care, and there's complexities and all that, and we've got to continue to drive that, but we really believe that, again, we're shifting dollars to where we know that we need the care gives us a great advantage to be responsible and create value. We are a very large Medicaid provider. In fact, we are the largest Medicaid provider in the state of Wisconsin. Over 50% of the kids our revenue are with the Medicaid program. So it's a very concerning issue to us, and we talk frequently with the new administration about all that. There's about 256,000 kids, 0 to 18, in the Milwaukee County. About 76,000 of those kids, or 29%, live at 100% of poverty. And I'm explaining this for a reason. 100% of poverty is, for a family of 4, less than $22,000 a year. So when we look at the state of Wisconsin, they did increase coverage levels to 200% of poverty, which for a family of 4 is $44,000 a year. And about a half of the Medicaid enrollees in the county are kids. The payments, though, are the lowest. Out of a $6.6 billion budget, the kids' cost in this is about $800 million. So we are, while we're a higher percentage of the numbers of people that are insured, we're much lower in cost because most kids stay healthy, about 95%. But when they need it, they really need it. So when I look at this and how I can be responsible and create value, it's a lot about what I've just talked about is, you know, if we're admitting kids to the hospital for asthma, which is one of our leading diagnoses, we know that there's evidence that would suggest that if we can make sure that homes are cockroach-free, these kids use their inhaler, our school nurses can evaluate and assess these kids early so that they don't have to come to the hospital, we can be very responsible and very responsive to lower that overall cost, not having a premature baby. But again, because of how the incentive systems are created today, you have to actually invest, which is the right thing to do prevention and wellness, because that's not how our current incentive system is built. So we're very active with Secretary Smith and Brett Davis to try to find and work on creative and innovative partnering solutions so that we can, again, try to prevent and create value, but then also look at efficiencies and ways in which we can continue to make sure that we are delivering a great product, high quality, at the right price.